Hi, I'm Dr. Renata Wix-Harris. I'm a cosmetic physician here at Reflection Center in Martinsville, and today I'm going to talk about lip filler for women over 40. Generally, women over 40 are more interested in rejuvenation of their lips, and that can be several things. It can be more smoothing and hydration, which you can get with lip filler. If you put it very superficial, you can make the lips look more hydrated and smooth without really changing the shape or the size. So this can also be achieved by putting topicals on the lips, like lip mask or lip plumpers. HA is a good one that really holds moisture in your skin and makes it last a little bit longer than a regular lip balm, so you don't have to reapply it. But again, doing it with an HA filler is a really good way to hydrate and make the lips look plumper without increasing the volume or the shape. So questions to clarify for yourself before you go see your injector is to determine, what do you want your lips to look like? Do you want them to be fuller? Do you want them to be just a little plumper? Do you want them to project more? Do you want them to look less wrinkly? Celebs are a good talking point because that really helps for us to understand what you're hoping that your lips would look like after treatment. Another question to answer is this a change of your lip shape, or are you looking to try to get back the way your lips used to look? It's sometimes easier to try to get back the way your lip used to look, although over time, when people age, their upper lip, their white roll is starting to elongate, and that can make it more difficult to get exactly the way you used to be in your 20s or 30s. There's some tricks that we can use to kind of roll out the lips and elongate them a little bit, but it's important to have realistic expectations of how your lips can look after lip filler. What's also very important is that it needs to fit your face. You know, if you have a petite face, then big lips may look very strange on you. Even though they look good on somebody who has a bigger face, bigger cheekbones, or a different ethnicity. All those things are important in how people's lips will look, compared to the rest of their features. Another way to rejuvenate the lips is to make sure that the border between the white roll, which is the skin above the lips, and the red of the lips, that border becomes more defined. As you age, that border starts to become less and less distinct, and that's when you have issues with your lipstick kind of bleeding into those little lines. With filler, you can create a more distinct border and create a nicer shape, especially of the Cupid's bow, but also this is important to create a good border so you don't have lipstick kind of bleeding into those little lip lines that you have. If the lip lines are pretty deep or more advanced, you're going to have to do something more intense, like for example a CO2 laser or threads. But if they're pretty fine, you can actually use Botox to improve them, or you can put filler directly into those lines to help smooth them out. And then finally, part of rejuvenation is restoring the volume that people have lost. Once you hit your 40s, you start to lose volume in your face, and your lips are part of that. And also the white roll is starting to lose volume, which supports the lips. So it's very important to not just treat the lips in people that are in their 40s, but you also have to look at how well is the support around the lip, to see if you need to put some restore some volume there with filler. So we can treat both aging and improve the shape and restore the volume. It's very important for patients to understand what would work best for you. And during our free consultations, we go over all the different options with you and then create a plan that would work best for you.